Patients are falling through the cracks in imaging every day. WeScan Diagnostics is closing those gaps with Concierge Ultrasound that saves lives. Today on DocStars.
Welcome to DocPod's DocStars.
Hello everyone, I'm JJ and welcome to DocStars on the DocPod channel. Today we're joined by the leadership team at WeScan Diagnostics, Malley and Monica Frymyer. This is a woman-owned company founded by veteran sonographers who saw one problem again and again: patients falling through the cracks in imaging access. This is something we're going to talk a lot about today. Their mission is clear: close the gaps in image accuracy, timeliness, and of course, access by bringing concierge-level ultrasound into clinics. So today, we're going to explore several topics. We're going to talk about how too many patients suffer delays, errors, and unnecessary radiation from over-reliance on CT, as well as how real-time ultrasound, when done right, can save lives and reduce costs. Very, very important. Number three, the evolving landscape of diagnostic imaging in the age of AI. That's exciting. And the hidden education and training gaps that impact both doctors and patients. So a lot to get to. Monica Frymyer, of course, Malley. Welcome to DocStars, ladies.
Thank you.
Thank you. Thank you for having us, JJ.
I'm very excited because we talked a little bit before we started, and I spoke extensively with Kat, and I think what you guys are doing is really unique. And I suffer, and I know a lot of us do, as patients, and I want to frame this a little bit because every time I go to my primary care provider or I go to maybe a clinic, most of the time what I find is that they diagnose and then they want to get an image or take a scan, but I can't do it on premise. I have to go somewhere else, book another appointment. It takes another week to do, and it just delays everything. So when I heard about your company, I thought, wow, this is really innovative. So let's talk a little bit about what you guys are doing in terms of the origin and closing these gaps in imaging. So what's the why behind WeScan Diagnostics? You know, that's what I really want to hear about.
Well, and that's really where we saw the gaps of patients coming in who could have had these scans done in office. And yet they were coming through the ER, and it's all throughout everywhere. And so we decided we'd had enough of just seeing those patients, because when you go through the ER, it's really, are you dying? Right? That's the main thing that their concern is. And it's, yes, it is diagnostic, and yes, they do find things, but then it's got to go back to your primary, and they're kind of in this washing machine. Right? Nobody is managing their care. And so we decided to come to Florida, where there is a great need for this type of service. And that's really how it started.
Yeah, absolutely. We feel by bringing it into the offices, that's where you get that continuity of care, and it streamlines it. So, because what we were, like Kat said, to reiterate, is you go to the hospital and you may see the physician, but then you get referred out. You don't even get to go back to your physician. So then you get lost, like she said, in that washing machine mode.
Yeah, exactly. You get lost or it gets delayed, right?
Mhm.
Because
Yes.
that information, can get easily be moved around, then it gets delayed. And during that delay could be crucial, right? Because different things are happening during that time or should be happening that you want to be aware of. And if that gets delayed, that could be pretty serious. Now, also I read a little bit before the show on hearing this incredible example, like the 13-year-old who was delayed for, I think, like a year. Is something like that. Maybe talk a little bit about that particular case. How did that happen, and what did that look like for her?
Yeah, that was a pivotal moment for both of us. I think we were both there for that case, and it was a young girl, my daughter's age, pretty much, and had been complaining of stomach issues for about a year. And she'd gone to a primary care provider and complained of this. She had gone to another specialist. She'd even come into the ER once, and continuously complained. And they put her on omeprazole, and they did all these other things. And when she finally came through the ER a year and a half later, and I put down that probe, she had masses everywhere, and she died about 6 weeks later. So that was a particular outcome that she had just been ignored. Perhaps they had sent an imaging order out to an imaging provider and they didn't take her insurance or whatever the case may be. She slipped through the cracks. And that's one of many stories that we encountered all throughout the country. And so it really was a moment where we said, enough's enough. This could have been a simple abdominal ultrasound or a pelvic ultrasound in office could have changed the course of that child's life. And she may or may not still be with us today.
Yeah, which is an incredible story and really horrible to hear on one side because obviously someone lost their life and it could have been prevented, like you say, by kind of instituting and, executing on the ideas that you guys are currently doing. But at the same time, hopefully that sparked something in you guys. And that's why we're here today, because I think it's a great cause for what you're doing. And you talked about falling through the cracks, how we can make sure these types of things don't happen again. So let's talk about that. Why do patients actually often get bounced between ERs, providers, imaging centers, all of these types of things? Because it does happen a lot to myself and friends I know. How does that actually impact the outcome when we're all getting bounced around so much, in addition to what you were just referring to with the poor young 13-year-old there?
So I believe what we see is like when you come into the hospital, you're seen by the ER. If you get admitted, then who oversees your care? Is it your primary care that comes in and sees you? No. You get the hospitalist. And then the hospitalist has this whole protocol of, well, this patient has a GI problem or a problem. So then they get sent to a specialist and ultimately all of your imaging and all of your records get sent back to your original primary care doctor outside of that hospital? Yeah, I would say yes, they do, but majority, I mean, how many don't though? Why do we slip through? I mean, is that why we're seeing these cracks, of misdiagnoses and lack of treatment? I mean, where does it go? How do they guarantee that? Especially when you're already referred out once you're in the hospital.
Correct. And what we see at our imaging center in Chiefland that we opened up, there was a great need there. What we see is a lot of patients are still having to chase down their reports. We get referrals for their reports needing to go to different specialists, and patients are so frustrated. So, especially when you're elderly, to go chasing down things and go to different specialists and get this imaging and sign this paperwork, you're like, I don't even know how to open my phone. I don't know how to do this. So, we try to coordinate and help them as best we can. But if it were kept within their primary care office and they could get the imaging done and it could be managed, that your primary care, yes, it's supposed to be your lead, right? They're supposed to be guiding your care. And whether they refer you out to endocrine or they refer you out to GI, they're managing them. And we know a lot of great primary care offices that we contract with, and they're great coordinators of patient care.
Yeah. It's interesting. When you're talking about this, I'm thinking about my own experience. And one of the things, I lived outside the US for about 20 years. And one of the things that drove me crazy when I came back to the US was I have this wonderful thing called MyChart, right? Where I can see all of my information provided by my primary care provider. I'm like, this is incredible. This is fantastic. And then I go see somebody else, and guess what? They have a different MyChart. And it's the exact kind of similar model for me where it's all fragmented. I can't believe that we don't just have one. Everything is there. That way, no matter what doctor I see, there's transparency. Nobody slips through the cracks. And I think about that as a comparison to what you're doing in the sense of when I go see my primary care provider, if I have to go somewhere else, I remember I had an image for my prostate last year, and I had to get that image to my primary care provider. That took weeks. Then I was more expensive. So you guys are building a new model. Obviously, it's broke. We know that you can go mobile, if you will. Instead of being just mobile, why did you focus on, really true partnerships with practices? Maybe talk about that and how that really works so well for you guys.
I mean, you should. The loyalty, and you should have the confidence in that patient to get the the best care that you can receive. So if we provide those services within house, where are they most likely to come back to get it? They're going to come to the office to get it. So that's where the streamline comes in. And not only that, like when they come in, the doctor, that physician that we contract with, has all of that. All those records are accessible to that office, so they can get on, they can view the images, they can see the reports. Not only do we push the reports automatically once they're read by our radiologist, but they have that access, that what do I say,
They have a portal.
expedited access in order to see the imaging and the reports. So therefore, the care is can be executed quickly and in a more timely fashion.
At a higher quality. And well, we focus on partnerships because we are not just a concierge ultrasound company. When we come in, we focus on the staff. We educate them on different new exams that have popped up. We follow HCR protocols, but there's always new types of ultrasound that we are doing and going to congress with and learning. So we try to educate them on all different types of the exams. And when we look at a patient history, we can then, if they've ordered the wrong exam, then right then and there, we're able to change that exam and make sure that the appropriate organ is imaged. Because a lot of times we see a patient goes complaining of a certain type of pain, and then the imaging order is wrong. Well, an imaging center is not going to be able to get that changed right away. The patient will either have to come back or the wrong organ will be imaged. And so we're able to make sure all of that is dealt with and performed, and then the report is accessible to that physician. So we're training staff, we're getting billing on board if they're going to do their own billing, which increases their bottom line. Right now, primary practices nowadays, they're popping up. They want lab in-house, they have imaging in-house. They're these conglomerate companies. You see Vitus, you see all of these new corporate primary care facilities popping up, and they have everything. So there'd be a new primary care office and you're not offering that, you're not competing.
Yeah. No, I think this is a form of kind of vertical integration, right? Having everything as much as you can in terms of the imaging in the same location as you've already talked about, which is great. And if they build, obviously, newer centers, then they don't have to retroactively kind of put all these imaging services in there, because I don't see a lot of them. And what you're doing is exactly that. So how would this work? For example, let's say I have a practice, but I don't have imaging, because as you mentioned, it's not just providing a certain machine or an ultrasound machine. It's also the staffing and interpreting, of course, that data, because it's several fold. And I think that's really impressive. It's not just going there, dropping off a machine and then checking back in at a later time, right?
No, not at all. No, because like I said, when we're coming in, we're bringing our machine, we're bringing the tech, and then we have a pack system where we have to hold those images on file for 7 or 8 years.
It's 7 for adults,
7 for peds, 7 for adults, 8 for peds. So we have to keep those stored in the cloud for that many years as well, which this is alleviating that from the office as well. Pretty much the only thing we ask of the office is to schedule our patients, and then they have the option whether or not to bill. So it's pretty easy for them.
All they do is provide us.
They provide us.
We take care of everything else.
Exactly.
Yeah.
So the liability.
You guys are providing all of the extras, right? I mean, you're managing the data, you're providing the machine, you're interpreting the data, all of this. Yeah.
Yeah. So the liability to them is very little.
Yeah, no, we take on the liability as well. And we have certain doctors that read certain imaging. We've got somebody that focuses on OB, somebody that you're not going to get that at any other facility, because we really go back and look at our reports, make sure they don't need addendums, make sure they don't have mistakes. So if you're a primary care physician and you're wanting to increase your bottom line, increase your patient volume, increase your patient retention, then you simply give us a call. I hate to say that. And we set you up with a day, maybe a mock day, and you start scheduling patients, and we kind of walk your staff and everyone through the entire process. We come in with our supplies and obviously our machine, and then take it from there. And then they'll get the reports within 48 hours.
Yeah, I love it. I mean, to me, I think it's odd that it hasn't been done. So thinking about that, what are the drawbacks for that? If I own a clinic, why am I not already seeking this out to outsource this to someone like WeScan Diagnostics? What's the drawback? What's the fear? I'm trying to understand the hurdles there, because it makes so much sense to me.
Yeah, we try to figure that the negative to this. And I think the trust is a big
Yes.
issue. And um, we talked about kind of how doctors go to CT, right? And that's they perhaps, that's kind of their go-to because they feel like that's more reliable. And you've got a lot of schools, especially here in Florida, pumping out a lot of new techs. And since COVID, I don't know that they're getting the clinical experience that they used to get. It's everything's kind of fast tracked along. So I feel ultrasound is tech dependent. And you really need to be knowledgeable. We require our techs to really know their stuff in all aspects of ultrasound. So I think as a provider, maybe that's worked in the ER, where you have a high turnover of staff, perhaps they don't trust that the read is going to be correct. So, I mean, what other drawbacks?
Because we did encounter an office and we were really positive about it. We really thought we were coming on board with this physician, and we went back and he told us a horror story because he experienced it before, with having someone come in, but he bought the machine and he just had a tech come in, and it was basically a family friend child that did it. But I don't want to say child, but adult child. So, and he had an ill experience. So we've been still trying to convince him because he did like the service. He enjoyed having it in house because of the accessibility to the patient's chart. And we're so I think that's the biggest thing. I think it's about
They made a mistake.
they made a mistake.
Misdiagnosed a family member.
Yeah.
And
Yeah.
he said, well, no. So, because you don't want to put your patients at risk, right? Even though that we have the liability, you're still having this coming off as figure. So, I'd say, because we thought, like, if somebody came to me as a physician and said, you can increase your bottom line $500,000, there's no down, there's no money needed to do this. And help your patients and not slip through the cracks and all of that. What on earth? I'd be like, please sign me up. I don't have to buy anything. I don't have to staff.
You don't have to pay us.
Yeah. Yeah.
Exactly. But I think all of this speaks to how we are as humans, which is a lot of us, hopefully not me included. My wife says I'm pretty good at this, but is we don't like change, right? For whatever reason, we don't want to change. We just want to keep doing what we're doing. But if you told me, A, you can increase my bottom line, quantify that for me, show me how I can make more revenue. B, I'm delivering a way better guest experience, right, to all of my patients that are there. C, I'm keeping them with me because I'm vertically integrated. For me, it makes total sense. Now, I've heard the word, ultrasound being thrown around already a lot, on this conversation. So for people like myself who aren't really medically inclined, let's talk about the power of ultrasound, because I want to understand that a little bit more. What makes ultrasound safer? Why is it more cost effective? And also, faster in many cases. What does that look like?
Well, ultrasound is safer because it doesn't use radiation. It's not a magnet either, like MRI. We don't use contrast in offices. That's a new thing. We do use contrast in the hospital settings, but that's not something that we would do in the office. Um, so in that case, we're not setting your patient up for any kind of kidney failure because of using the contrast like they do in MRI or CT. And we don't use radiation. So that's where the safeness comes in. As cost effective, um, basically, uh, Medicare is reimbursing at a much lower rate than what they would for a CT or MRI. And it is much quicker because, a typical MRI is going to take you 30 minutes to an hour. And if we're just scanning your liver for ultrasound, we're done in, 15 minutes or 20 minutes. So time-wise, yes, it is more time efficient as well. Now, as for diagnoses, it's just dependent upon what we're looking for, because there is gold standard for certain things, certain anomalies or disease within the body. So that's just dependent upon the modality if ultrasound is chosen for that, if we are the gold standard for that.
Yeah, but we can
That
in
makes
real
sense.
time see if somebody has a life threat, if they have
Yeah.
DVT, if they have a deep vein thrombosis, if they have a clot in their leg, right? We can in real time see if they have masses in them, right? And we can expedite when we see those things. We can expedite that report, expedite that exam, and get that result to the provider, very fast, right? Faster than a hospital even could. We talked at, she brought up CT and radiation, and, we've worked in the hospitals all over. The change that we've seen with them radiating with CT, sometimes some patients 18 to 20 times. It's incredible how misused it's become.
And I think part of that is because of just malpractice. I think pretty much they've gotten burnt one time, and then that's what I've seen is they get burnt one time, and then everybody gets a PE study that comes through the ER. You're short of breath? Oh, let's do a PE. So, and that's what they do.
Yeah,
Is it
100%,
warranted? Is it really
100%. And
warranted? Warranted that the labs come back and indicate and point you in that direction? Half the time not, but they still do them.
yeah, I agree 100%. And it's interesting when I was doing my research as well, I saw they were talking about, what they call the training gap, right? Like post COVID ultrasound grads, it was said that, they're getting less clinical exposure. Does that kind of contribute to maybe eroding confidence in ultrasound as a first line tool? And if so, how do we get past that? What are your thoughts?
Ultrasound's an incredible modality because you can look at everything: the heart, the legs, the blood vessels, the arteries, the brain. We've transcranial Dopplers. There's there's fetuses. There's everything, pelvic organs, prostate, right? There's everything that you can image. And so as a sonographer, you really need to be knowledgeable in all of those aspects. You need to do OBGYN, you need to do vascular, you need to do general. You need to have all of that knowledge. And so the techs really need to be educated in every aspect of the body and all pathologies, and then get the experience within the hospital to see disease, to see what it looks like, see what it feels like. I mean, we could stand with our eyes closed at this point, but new techs haven't gotten there, and we I would say it's the training and COVID, and because we've seen students and they're kind of bounced around. They don't get a lot of clinical experience. They don't go into, back in the day, you gowned up and you went into every room possible, C diff, everything. You were going in there, and now they have to stand outside, because of COVID, and now they don't go into those rooms, and they miss so much, patient care wise and seeing the pathology, to having to deal with those really, really sick patients.
And I've seen
Yeah.
that because we have students under us a lot of the times in the hospitals when we were traveling, and it was just like they didn't even know the correct way to hold the probe and in what direction anatomically to hold the probe in order to obtain that image on the screen. So it was just like, what did you learn in school? What happened to scan lab? Like, where did we weren't trained like that years ago. So it was like they were very hands on with us, and I mean, I felt like I really had the best mentor ever. So um, I'm just appalled that they're sending these students out like this and setting them up for failure, because it really is. And not only to the student, but to the patient, because they're
Yeah,
hiring them. And then they're
that's
not
right.
overseeing them. And then there's no training. And it's just like, well, 3 strikes you're out, we'll just fire you and we'll replace you, and that's not the way to do it. We got to train these students.
Exactly, exactly. And again, I think that's where I see a lot when I go to different medical centers. Everyone's busy, everyone's got 1,000 things to do, and these things slip through the cracks, right? And this leads to my next question, which you actually just answered, which was, what's the advantage for a primary care, my PCP, or an OBGYN practice to partner with you instead of hiring the staff? And I think it's exactly what you talked about. You can ensure the quality of that interpretation of that data with the staff that you have, knowing what they're doing, different modalities versus them having staff that really haven't been trained properly in school and getting not the results they should. So that's a huge benefit, as you said, right?
And but how do we show our credibility to these physicians? Like, how do we express that to them and them know it? I mean, yeah, they can go scanning, but still, does that really show your skill set? No, they have no clue. So that's where we are, is just trying to make these connections with these physicians in order to provide the service to them and their patients.
And it's word of
Yeah.
mouth.
Yeah, big time.
But when you hire staff, right, you
take a chance.
you take a chance as well. And staff, it looks good on paper. I'm only paying them this hourly, but you gotta think of everything. Right? Insurance, there's so much. They say when you're going to pay somebody 40, make sure that you have 80 in the bank, right? Because it's going to cost double that when you hire somebody on board. And they can never take a break. They can never go on vacation, right? Because you've got patients that have needs.
Full time, 100%, 100%. And, I'm looking at this, I always think kind of like big picture, how does your model work in terms of how is it beneficial? You have a technologist and a provider working side by side. For me, that changes the guest experience completely, right? In the entire patient care, because they're not separate anymore,
Yeah, we follow,
which is fantastic.
when we also follow gold standards when it comes to how we treat our patients, right? I always say if you're getting into healthcare for the money, you're in the wrong business. Don't do. You have to love patients and really want to and care about them and want to find out what's wrong. That could be your mother, your brother, right? It's so important to treat patients like they're your family. And so when we scan them and our staff that scans, we make sure that we're really, catering to them and talking to them and they leave always, they come in nervous and they leave smiling. That's what we want.
Yeah, which is incredible. And that's coming from WeScan Diagnostics, right? So I love, again, I keep talking about the vertical integration, but I love that you carry it all the way through with the patient care. And so I think it extends it. I feel like we're being taken care of better because, again, it's all in one location. You guys handle it. And that's just such a great service,
We agree.
Yeah, exactly. And it's interesting because, again, it's change. A lot of people don't like change, as we know. But maybe talk a little bit about the time frame. Let's say I'm a clinic and you approach me and you're like, "Hey, we can do everything that we just told JJ here on DocStars." And I'm like, "Great. I love it. I want to sign up for this. I can save money. I can keep it all in-house. I can have better patient care. I can have a better guest experience. I can have a better trained staff diagnosing all this. So this is incredible." What's the time frame? What does that look like if I push the button and say, "Let's do this"? What does that look like?
Well, the first thing we do is we kind of look at your EMR system and see what you've been ordering. Look at how much you order, how many ultrasounds, so we can know kind of the scheduling and really cater those exams to make sure that we have appropriate staff for you. And then we pick a day and we start training your staff on scheduling if that's something that they want to do. And like I said, billing wise, we make sure that if you're doing the billing, that we've got all of that straight. There's, of course,
CPT codes.
see all the forms, all of the anybody that does billing has my heart because it is quite the feat, right? Learning that has been so fun for us, and we do accept all commercial payers at this point, almost all commercial payers and Medicare, Medicaid, at our on-site imaging center in Chiefland, but so learning billing has been incredible.
Yeah.
So, but we're now experts. So
Yeah.
now,
Yeah. We can train you.
and we have experts. We have people we work with that are even more experts that have 20 years doing this. And so we help
So is it
onboard.
easier? By the way, I started interrupting. Is it easier to get your machines into other clinics and bring them into your system where you guys can run that? Or do you find it's easier simply to continue bringing people to your location in Florida where you're at? And how does that look?
The people of Levy
Gracious.
County are incredible. They're wonderful, wonderful people, and they didn't have any imaging within the county. I mean, it really, that people were having to go all the way outside, and that's what prompted us to kind of take a great amount of time and open that facility app. It's because there was a great need, and we thought people are driving an hour and a half.
You got to think.
Ultrasound.
I don't know if he knows where Chiefland is, but It's in the national forest, okay, of Florida, if that says anything.
Is it like kind of north, like just west of like Gainesville, that area?
It is south
Okay.
southwest.
Yes,
Hmm.
yeah,
Southwest. Okay.
Hmm.
yes. So
Yeah.
it's just more like little villages out there. I mean, do they call them
Yeah.
towns?
Yeah.
No, I don't know. Are there towns?
Hmm. Yeah.
So
Yeah.
so what makes the difference? And then, sorry, Kat, I interrupted you. I
No,
just had to put that out there
yeah,
with our
no.
state.
I mean, so we love it there, but I think going into the office is definitely better for the provider.
Yeah,
It's more convenient for the patient. I'm sure they'd love to just go to their office. Patients want to stay where they know. They want to go. A
Exactly.
lot of times we get imaging orders and we'll call the patient to schedule, and it's a couple of weeks before they can even get in and get their schedule. If it was done and then they've got to go back to their provider, have another office visit, go over. Patients want to stay where they know. So if they could, if somebody said, you can have this done here, we'll put you on the schedule. Oh goodness, they're already excited to cut their trip down an hour and a half. If they could
Yep.
cut it down even more and go in house, they would be elated. And this is not what this is about,
Yeah.
right? Making it easier on them. Life's hard enough.
100%. For me, as I listen to kind of your business model, what you guys are doing in the mission itself, it's about removing friction, right? It's about me being able to go to my primary care provider or wherever I go and have it all done in one place because it's already hard enough with the insurance right on the back end, handling, do I need an authorization to go over here, blah, blah, blah. So if you can put it all together in one place, which is what you guys are doing, for me, it's fantastic. All right, so let's talk about the future of imaging, because I'm a bit of a tech nerd on the side, and I'm always thinking, how is tech going to impact this? So where do you see AI playing a role, in ultrasound? And let's talk a little bit about what's hype and reality and what the future looks like there. What are your thoughts?
Well, we've actually had quite a few radiology groups reach out to us. They use AI. I think it's great for radiologists. You got to remember when you go to an ER, your exam's being read by a resident, most likely, and they are bombarded and overwhelmed in these large hospital groups. And then an attending then signs off on that read, right? That a resident and new. I mean, I remember how I was as new into the field, right? I needed that oversight. Let's just say that. And so you've got an attending who's got to then overread hundreds and hundreds of exams in a timely fashion. And then if they're attending, they're probably an IR, they've got procedures. So AI assisting them, I think, is a win-win.
Mm-hmm.
Overreading, they'll never have, AI doesn't have an MD, right? So they're not going to be taking over, I think, anybody's job. But any kind of because things are messed, right? We request addendums even on exams, and we have some of the best rads that we have ever found. So AI will definitely help that aspect.
Yeah, definitely. I think it'll
Yeah,
help.
and I love it because, again, it's a tool, like you said. So it's not replacing people. It's just more of an additional tool because, as you guys know, there's so much information processed, right, in the medical field that's what AI does best. It can kind of alleviate a lot of those issues early on, of at least gathering and organizing all that information. So then the people who really know what they're doing can then spend their time doing what they know, which is assessing that, interpreting it, understanding it, right?
And I think it's going to be integrated onto the machines a little bit more too. I read something about that where it's going to be like AI will be on the machines where it can assist whoever is scanning, like, hey, go superior, or go inferior, or something like that. But for it to actually move the probe, it has to be a human.
Yeah. And I think that's great because it can assist. I was reading an article the other day about even attaching, like what you said, AI at the point of contact and then using it to kind of walk you through. And they had an example of a stethoscope, which was heavy. It was like 2 or 3 pounds. Obviously, over months and years, that will get lighter and lighter. But the idea is that even someone without a lot of knowledge, maybe a doctor's less experienced, but has some experience, then the AI is then letting them know exactly where to move it, what to listen to. And the AI can also listen to it. But like you say, put it at that point of contact. That'll be an interesting development for sure.
Thinking, okay, if the portal vein is dilated, I need to look at the spleen, right? There's portal hypertension there. I mean, and I could be wrong, but I use a lot of it outside of work. There's just the cognitive thought process, right? Of evaluating pathology and then thinking ahead and making sure that you're looking at all aspects of that patient, right? You've spoken to the patient, you know their history. I mean, a lot of times somebody comes in and I go, well, I have pain right here. Well, okay. Or I have a pelvic pain. You know, you're asking them all these questions, right? How are you urinating? Like, how are you? All of these things you're asking the patient, and then my mind's going.
You're writing it down,
right? How often do you use the restroom? How do you? All of these things, I'm thinking in my mind. Okay, we need to have this. We need to do this, right? We need to look at this, right? Obviously, I have an order to back that up, but
Yeah. No, I agree with you. Real life interpretation. We'll get there eventually, but not yet. I think right now, like you say, it's just more of a tool, and then real humans are right there to kind of guide it, interpret it, understand maybe, if there are areas that there's crossover patterns, et cetera, so they can interpret that really well. All right, so let's talk about, at the beginning of the show, unfortunately, we talked about a sad or real case, real impact situation with that young girl who was 13 years old, where maybe if we had these types of equipment and machines, we could have saved her life. So talking about life-saving stories, can you share examples on the more positive side where you have a timely ultrasound that actually changed the trajectory of a patient's life? Because that would be an amazing, for me, I think. Unfortunately, we heard the negative, but I imagine there must be some great positive that you guys have run through where, yes, they used it on site versus being delayed by weeks or months, and that really helped them out, with something.
I think anytime you have an elderly patient that comes in and has a positive DVT and you can keep them out of waiting in the ER for 6 or 8 hours, and you can get that red, get them on a thinner, and it prevents the PE in an elderly patient, I think that's always a win. I would say a lot of our breast patients, you need to be really knowledgeable in breast. I think Monica's one of the best, to be honest. But and our staff, of course, is incredible. So anytime you're scanning through a breast and you catch a mass and you can get that patient treated right away, I think that's always an incredible win for us. I know we had a patient recently and we already got a referral from oncology and they're being able to be treated. And they came in with just felt something, and they were able to get in within a couple days. They were so excited. And now it's only been about a week and a half and they're already seeing surgical oncology. So that's a win.
It is definitely a win because, I mean, that's one of the biggest, cancers in women is breast cancer, and it's our biggest fear, and we're seeing it in younger and younger women. So, and this girl, she was in her 30s. So it's a good thing that she did come in when she did come in so that we can be proactive. And, and that's the thing is when we see those things, we kind of flag those so that it is seen by the radiologist sooner because we do have that capability so that we can get that report back quicker. And when we do see positives like that, us as techs, I hope all of us as techs look at that and watch for that report and make sure that it was dictated correctly so that the patient does get the proper care.
Yeah. I mean, what I'm hearing is expediency, right? Timeliness, making sure you get this stuff as quickly as possible for any scan for that matter. And earlier in the show, we talked a little bit about, these education gaps, if you will. So how do you help providers know when ultrasound is the right first step for them? I'm a provider and I say to you guys, hey, I love what you're doing, but how do I know if ultrasound is the right first step?
I have to say it's always the right first step.
Because there's no radiation.
There's no radiation. I mean, we have kidneys, but we put them through enough on a daily basis. And
your liver.
And your liver. So to radiate a patient is never the first answer. And it is going to backfire eventually. I really feel that wave is coming. We're in the wave right now of radiating. But I think that change is going to come where providers are more weary of going straight to radiating patients. I would say ultrasound is always the first modality, of course, with the exception of the lungs or bone, and brain for the most part. Adult brain,
Yeah.
little brain, not. But yeah, that's my answer to that one. I feel very strongly
because we've scanned a lot of things that,
could have been done by ultrasound.
By
well,
ultrasound.
and we
Yeah.
have done them, and it's like, oh gosh, really? Okay, we're gonna
I'm going to
scan
say
this.
something that might sound controversial because I'm not in the medical field. And I want to just look at this always from the other side, a different lens. So, for example, when I hear that, I'm thinking to myself, why don't they use ultrasound more? Why are they not scanning with ultrasound more? Is it totally wrong for me to assume, and it might be, I want to hear from you guys to say, well, they use the other types of scanning because they cost more, they can build the insurance more, they make more money from their margins. I don't know, but I'd love to know why they don't use ultrasound.
In the hospitals, at 100, you go to CT, they're getting 20 grand for that exam, and they're
Yeah,
not getting for an ultrasound. I hate to say that about healthcare, but that's what we're.
But then too, when you come in through the hospital and they order a CT, you got to think when they scan, like I said in the beginning, everything is included. So if you're scanning the abdomen pelvis, you're scanning everything from the diaphragm down to the pubic bone. So every organ, all the fatty tissue, adipose tissue, everything is being visualized at one time versus being just solely focused on one organ or one quadrant.
got it. Got it. Makes sense. Makes sense. All right. So let's talk big picture. All right. We talked a little bit about some portions of AI within this, and let's talk about healthcare and imaging like 5 years from now, because I know a lot of stuff is going to be changed in the next 3 to 4 to 5 years as more AI models come online. Obviously, better training, new delivery models. What does diagnostic imaging look like over the next 5 to 6 years? We'll start with you, Kat, and then Monica, I'd love to hear from you as well. What's our future look like?
Yeah, I think every office is going to have imaging in-house in order to compete in the market with these large corporate primary care facilities. So I definitely see imaging being more accessible. I see at least X-ray and ultrasound, of course, being in-house, which just costs too much to have a CT scanner, but perhaps that price will go down. That's what I see. And I see ultrasound becoming used more. I do. I think it's going to be used more and more. I mean, our machine our couple of machines we have are incredible. They're the newest models. I can't wait to see, the newer. We have Mindray. We love it. Shout out to Mindray. They're a great company. We love our GEs, of course, as well, but we do use Mindray mobily. The imaging quality is exceptional. So I expect that to just get better and better.
I agree with Kat because I think traveling all over the United States doing this, and like in the cities that I have been in, everybody, they have their own little primary cares. But down here in Florida, we're seeing more like physician groups. So they're larger groups. So then they can sustain that cost of CT, MRI, having it on site. So with having, anywhere between 5 and 10 physicians, I can't see why it wouldn't be going in that direction of having their own imaging centers within house. Because like she said, the reimbursements on them once you get it in house is unbelievable. So it's sustainability for them as physicians, and it's having, providing that service for their patients to keep them happy and loyal and keeping them there. So,
And less cost
Can't
for the
wait.
patient. Yeah,
Yeah.
less cost for the patient.
it would be less cost too. Yeah.
Yeah.
Exactly.
I see
Better
more and more.
experience.
Yeah, go ahead.
No, I was going to say better experience, faster experience, more cost affordable experience. So, like you say, this is 100% going to happen. It's just a matter of when, not if. Right?
Yes. And more and more people are getting rid of their insurance, right? So they need that low
Correct.
cost exam. They're not able to afford, a $10,000 CT, right? Or So we work for some great functional medicine providers who utilize us in the office, and so I think and it's increasing. There are more and more of them popping up.
Functional medicine is big.
It's huge, and they do utilize ultrasound more because they're treating the whole body, right? So
Not only that, it's like the patients there for the cash prices, they just don't even waver on it. It's like, yeah, get it done, let's do it, and because they're not getting a bill at the end. They're not going to get a radiology read fee. They're not going to get something that wasn't reimbursed by the insurance from the hospital. So once they come to us, and if you're doing cash pay option, which is very affordable, they're done. They know they're finished. They're not getting anything in the mail.
Yeah, 100%. And I've spoken to several of them already. A great doctor in Nashville who I was speaking with, a urologist, and the exact same thing. And he does that. And honestly, he gives them better care. He gives them faster care. They pay cash on the spot. It's actually more affordable for them because there's less friction, all of these things. Honestly, I would love to see a day. A lot of my family lives in Europe, and yes, they pay more in taxes. But I'll tell you, having something like a catastrophic insurance, for me, I'm very healthy. I try to live my life in a healthy way. I really just want kind of a catastrophic coverage. So if something really happens, I'm covered. But then I'm happy to pay a cash payment for the smaller things. So I'm not getting this huge premium every month. Maybe I use it, maybe I don't use it, that sort of thing. So it'll be interesting to see how it evolves, right?
Yes.
yeah, I agree.
All right. Yeah, so let's talk about empowering patients because my sister has some medical issues and she always tells me you have to advocate for yourself, right? I think it's important. We have great doctors out there. We have great people out there like yourself who are really doing a lot. But I still think we have to take responsibility as patients, right? So we have to advocate for ourselves. So how can we as patients ask the right questions so that they avoid unnecessary radiation and delays? What does that look like for us on the patient side?
See a lot of barriers sometimes because then you're questioning your position, and that whole thought process sometimes can be a roadblock for the patient, which is very saddening because they don't want to take that time to sit down and speak with you. So how do you break through that? Choose the right position. You interview the physician. I think that's where it comes in. You as the patient have to interview that physician, do your research and find out, read the Google reviews. Just because they got a PhD or doesn't mean they know everything. I mean, they may look good on paper, but if they don't have the skill set, you're not going to get
Yeah,
too far. That's
there are
the one.
levels to everything, right?
That's the
Yeah,
one that's going to order the CAT scan instead of order the ultrasound. So yeah, you got to
exactly. I mean, there are
interview.
levels to everything, as you just said.
Yeah.
You have to do your homework, right?
Yes.
Check with consider the source. Who is the source? Don't just blindly go to somebody. If you have the time, please do your homework, check out the physician, understand what they do. And again, it's okay. I think a lot of times we think, well, I don't want to question my doctor. That's one side of it. Then the other side is Dr. Google. I come in with a Santa scroll of information, acting like I know more than the doctor, but it's probably a nice balance in between, right? It's not always what you say, but how you say it. So if you're respectful for your doctor and say, listen, I've done a little research. I actually heard that maybe ultrasound might be better in this situation. What are your thoughts, right? So I'm trying to understand for us as patients the best way to approach it.
Communicating
Yep.
what's really where your pain is, making sure your doctor, have them repeat it back to you.
Mm-hmm.
Okay, I'm having flank pain, right? You've put that in my notes, you've put that in my chart because
And which side?
and make sure there's nothing wrong with that because a lot of times, you're talking to the physician and you're talking about, and you run on and all of this, and then the physician leaves the room and the MA is then going through the chart and inputting all of that information in there, right? And so it could be the wrong side. We had a patient just recently yesterday,
Yep.
and they had flank pain. They came in because they had a kidney infection and they wanted to check and make sure they didn't still have it because they were still in pain. They were having trouble urinating. And they had a liver order for elevated liver enzymes instead. Things like that, then they didn't get the care they needed, really. They didn't get their kidney. because it wasn't in the chart. We tried, but it wasn't in the chart. So really making sure, I think the best providers listen.
Yeah. Listen, communicate, make sure you pay attention, have a vested interest. This is your health, right? It should be hopefully the most important thing in all of our lives, because if we don't have our health, we don't have anything, as we know. So your mission, which I love again, is really critical. We talked about it today, but we talked a little bit about AI, some things that are going to help. But if you could redesign the actual imaging system like tomorrow, if you could pick one thing, what would you fix first? Maybe there's too many to mention. I don't know. Obviously, we want to get we want to get these machines in the clinics, but in terms of the imaging, do you think it's really pushing more from what I'm hearing today? And I love it. Ultrasound, like they're really powerful. They can do so many things without radiation. Maybe that's one of them. Yeah.
In the future of imaging is the radiologist and the tech working better together. I think we've gotten away from that a lot for many reasons, but when I had a doctor, Dr. Murillo, and he would come in and help me and watch me scan, right? And so we need to get back to that. And that's what I would like to see in the future of imaging. And I think that would help with what we've talked about, training techs and getting them to a better knowledge base, right? So having radiologist and tech relationship increase and could just get better would be my hope for imaging, and that's for all modalities.
That's all ultrasound.
CT now, a lot of places the techs are doing their own protocols now. I mean, what or needs to be radiologists.
A lot of hospitals, there's not even a radiologist on site because they're remote. And you have no phone number to call this rad. They're like, well, just do the protocol. That's not healthcare anymore. Because I'm with Kat. Back in the day, we would hang films. We would be back there with our rads. We'd discuss the case and learn. And I think that's the biggest drop. The ball drop right there is in the clinical setting for these students. Is they don't have that communication or that relationship with a radiologist or even physicians. I remember doing traumas and this trauma surgeon be over your shoulder looking, what do you see? What do you see? Show me this, show me that, and you don't have that anymore. We don't have that in healthcare anymore.
100%. We definitely need more real-time collaboration, right, at that exact location. So that's something we can definitely hope for. Love what you guys are doing. Kat, Malley and Monica Frymyer, again, thank you for sharing your journey, because it's a special one, I think, your mission and your vision, with us today, because again, from decades of experiences as sonographers that you guys have to building WeScan Diagnostics into really a true partner for providers. I think your work is proof that expertise and purpose can change healthcare together. So again, the work you're doing to close these imaging gaps, which we see everywhere, and we talked about today, right? Reducing the errors, providing safe radiation-free ultrasound has the power to really save lives. It's going to improve patient experiences, also reshape how providers even deliver care. So thank you for joining us on DocStars. Well done.
Thank you so much.
Thanks for having us.
Yeah, love having you guys here. Before we go, I'd like to leave our audience with our key takeaway from today's discussion. We actually call it the clear signal. Closing, of course, imaging gaps saves lives. We talked about that. Ultrasound isn't just a test. It's a frontline solution that reduces errors, avoids unnecessary radiation, and it delivers answers when patients need them most. WeScan Diagnostics is building, again, what they're building is more than just mobile imaging. It's actually bridging between patients and providers, ensuring timely, accurate, and compassionate care. So it's a reminder that when knowledge, technology, and partnerships come together, healthcare becomes not just faster or cheaper, but safer, smarter, and again, more humane for every patient. A special thank you to Kat, Malley, also Monica Frymyer, co-founders of WeScan Diagnostics. Be sure to check them out. Also like and subscribe so we can continue bringing you conversations with top doctors and healthcare leaders from around the world. And as always, follow the DocPod channel because health is everything.
Celebrating the world's best. This is DocPod's DocStars.